So I did my presentation on the Hanta virus. So what is the Hanta virus? So it is a virus that is found in the rodent population, mainly carried by mice and rats. So we have the main reservoirs, which are deer mouse, white-footed mouse, rice rat, cotton rat, house mice, roof rats, and Norway rats. So where is the virus found? So obviously the virus is found anywhere where the rodents may be. So a lot of times in abandoned buildings and attics, in fields where farmers may work or any other people may be working in those buildings, anywhere there's rodents that have been having dropping fecal matter, urine, any saliva. Once that air is contaminated and it's breathed in, and there's a chance that the human may contract this virus. On the right, you see a picture of a rat basically in a water source where if you have a rat or mice that contaminates the water or your food or you touch any of that or you eat any of it or you ingest it, there's going to be a chance that you can contract the virus. So how does one contract the virus? Well, as we said before, the virus is contracted mainly by humans breathing in the air with the contaminated virus. The virus can also be transmitted by an infected rodent to a human through an animal bite, which is pretty rare. The virus can also be transmitted by a human while touching air where a rodent's saliva or fecal matter has been present. However, it cannot be transferred by human-to-human contact. So, description of the hantavirus. It's part of the animal virus family Bunnieviridae. If you look under a microscope, it'll show up as an enveloped virus. They have a single-stranded negative RNA. In that, there's three different types. There's a small, medium, and large RNA strands. There's also three different structural proteins, including two glycoproteins. You have a G1 and a G2, and a nucleoprotein N. The large nuclear capsid with elongated particles, which helps with attachment and movement throughout the body. Here you see how the virus is taken in. It's taken in by endocytosis, replicated in the Golgi intermediate compartment. The virus will attack the endothelial cells, and then once done that, it'll continue to replicate throughout the body. So the hantavirus leads to a few different types of regional viruses, but there really are two main severe types. One is found in the US and the other is found in Asia. So the first one we'll talk about is the Cinnabar virus. So do I have Cinnabar virus? So with that, it usually starts off with flu-like symptoms. So you have fatigue, fever, muscle aches, dizziness, headaches, chills, abdominal pain, nausea, vomiting, or diarrhea. While the later signs are a lot more severe and they're basically pneumonia signs. So you have tightness in the chest and you have fluid in the lungs. So right here you'll see two x-ray pictures on the right where they show the fluid in the lungs. The top picture on the right, it definitely shows a more drastic case. With that, the main reservoir for the chance of getting the hantavirus is the deer mouse. It's most common in the US. It takes about 1 to 8 weeks before the symptoms really begin to show. There's a shortness in breath and fluid in the lungs, which is a little bit later in the symptoms. And as of 2017, there's been about 728 cases in the US, with a pretty high mortality rate of 36%. So it is a pretty dangerous disease. Cinnabar is found more in the western part, especially in the fall and springtime during farming season, where the air may be contaminated with all the fecal droppings from these rodents. Most of these cases were found in males and they aged around 38 years old. So what about the Hanta virus? This is the one that was found more prevalent in Asia. So the early symptoms include intense headaches, back and abdominal pain, fever, chills, nausea, and blurred vision. Individuals may have flushing of the face, inflammation, redness of the eyes, or a rash. Later symptoms include low blood pressure, acute shock, vascular leakage, and acute kidney failure. So it's still pretty dangerous. It's not as bad as the pneumonia signs can have, especially with the fatality rate, but having kidney failure and acute shock can really hurt the body. So the Hanta virus, which is primarily found in Asia and Europe, the main reservoir for that would be the striped field mouse. There is a lower percent mortality rate compared to the Cinnabar virus, so it's only about 5 to 15%. And yeah, but it's still a pretty dangerous disease. So when you're trying to diagnose the hantavirus, There's blood tests used and resulting which would have a high IgM or IgG antibodies. They're going to take a very long history of the patient's history and their interaction. What do they do during the day? Where do they work? If any chances that there could be a contamination there. And then chest x-rays would be definitely used for the tsunami virus to see if there's any pneumonia buildup or fluid in the lungs. And then reverse transcriptase to find if there are the RNA strands, the hantaviral strands. And then there are also rapid strand tests that are being made so it can be diagnosed earlier and faster. So treatment for the hantavirus, there really isn't one treatment for it. With the tsunami virus, you're going to really want to stay up in your electrolytes and keep drinking fluids. Once it gets a little bit more severe, there may be a chance you'll be put on oxygen due to the fact that you could have the tightness of the chest and the fluid in your lungs. For the hantavirus, however, there's going to be nutrient imbalances. So once again, you're going to be drinking fluids, keeping your electrolytes, making sure you get your nutrients. But once kidney failure begins, you may be put on dialysis. You'll also be given painkillers and any ointment that may be given to suppress the virus and early symptoms of it. Prevention, always wear masks, gloves when working in environments where rodents may live. Make sure to patch up any holes in your house or attic where rodents could get in. Always put traps out. Even if you suspect or you hear something, always put it out. Just be on the safe side. And then always wash your hands. If you touch anything, make sure to wash before touching your nose or your mouth, so you don't ingest it or have a chance of breathing it in. On this slide, I'm gonna do a quick YouTube video that kind of gives a basic overview of the disease.
Let's suppose that you're writing a...
In May of 1993, an outbreak of an unexplained pulmonary illness occurred in the southwestern United States. Within a short period, investigators discovered that 5 young, healthy people had all died after acute respiratory failure. By November, the specific hantavirus that caused the outbreak was isolated. Since then, hantavirus outbreaks have occurred in a number of places across the U.S. Hantavirus pulmonary syndrome, or HPS, is a severe, sometimes fatal, respiratory disease caused by infection with a hantavirus. Anyone who comes in contact with rodents that carry hantavirus is at risk of HPS. Rodent infestation in and around the home remains a primary risk for hantavirus exposure. Even healthy people are at risk for HPS infection if exposed to the virus. In the United States, deer mice, cotton rats, and rice rats are the reservoir of the virus. The rodents shed the virus in their urine, droppings, and saliva. When fresh rodent urine, droppings, or nesting materials are stirred up, tiny droplets containing the virus get into the air. It can be transmitted to people when they breathe air contaminated with the virus. There are several additional ways rodents may spread hantavirus to people. They include, if a rodent with the virus bites someone, the virus may spread to that person, but this type of transmission is rare. Researchers believe that people may be able to get the virus if they touch something that has been contaminated and then touch their nose or mouth. And researchers also suspect people can become infected if they eat food contaminated by urine, droppings, or saliva from an infected rodent. To learn more about the hantavirus, HPS, or other infectious diseases and environmental or indoor air quality issues, please visit the website shown on the screen.
So that was a really good video, just a brief overview of how it's contracted. And then the last slide we have here is just the references. Thank you.